So my first introduction to podiatry was in a college fair where I had representative of one of the podiatry schools in California talk to me about it. It got me intrigued because I knew I would getting into specialty right away. I did like the surgical aspect of it, which I always was keen in learning and getting in future. I then followed and shadowed a couple podiatrists. I was amazed how important it is for someone to able to walk, or also the wounds, diabetic wounds, which I have a personal family history of diabetes and wounds, and I've seen it, how people struggle with it. And where I grew up in India, there were none podiatrists. So here I thought there was a care, there was a specialty dealing with it, and people actually having good outcome from the treatment, which does not exist in a lot of other countries. So podiatrist is basically focuses on foot and ankle. We get into a depth of lower extremity and biomechanics of foot and ankle. So we treat everything related to foot and ankle. Maybe it could be skin problems, bone, nerve, a lot of issues. So it's a holistic approach to treat foot and ankle issues. Not many people are aware of the podiatrist, them.
Uh-huh.
So again, if it gets worse, you have not seen your primary doctor at all, you have a wound and you have neuropathy. Neuropathy basically means it damages to your nerve that you cannot feel much. So you could be running around with the sore in the foot and you don't feel nothing. And you think
Mm-hmm.
everything is fine because it doesn't hurt, but it's not
Uh-huh.
like that. You end up getting osteomyelitis, which is a bone infection, and that's when things have to be a little bit more aggressive for limb
Uh-huh.
salvage.
Can you explain to us what the differences are and what the process is like of
Mhm.
becoming specifically a doctor of podiatry?
Absolutely. So, Doctor of Podiatry is a podiatry school, just like how dental school are and optometry school are. It's a separate school. It's a separate school which puts you in a specialty right from the get-go. The curriculum to me, the first 2 years are similar that normal traditional medical school where you take pre-med, classes, and the 2 year rotations after are also somewhat similar. But the fourth year we focus a lot on podiatry aspect, which
Uh-huh.
is more surgical medicine and everything. So I think it's like you take all the classes of medical school in addition
Uh-huh.
to other extra classes for you to become a podiatrist. Like biomechanics are very, very emphasized, and anatomy is very much emphasized, and all the other things. Yeah.
Mm-hmm.